Hi, I'm Kouros Nouri-Mahdavi. I'm a professor at UCLA Stein Eye Institute, and I'm a glaucoma specialist. One of my areas of interest is the study of structure and function in glaucoma. So we recently published a study where we looked at the rates of change of retinal nerve fiber layer as measured with two different OCT devices, SPECTRALIS OCT and Cirrus high definition OCT. We have had these two devices for a long time in our clinic. We are and have been using both, and in the study that we call the Advanced Glaucoma Progression Study, we actually measured OCT RNFL thickness with both devices over a period of 5 years. In the first cohort had been enrolled starting in 2012. And so these patients underwent measurements with both OCT devices, and we looked at baseline measurements, compared to baseline measurement, RNFL thickness measurements between the two devices, and also looked at the rates of change of the retinal nerve fiber layer over time between the two devices. And this is a study that really had not been done before, and we had the luxury of having the two devices available for the study, and therefore we were able to compare the performance of the two devices for measuring the rates of change and measuring the variability of the thickness measurements over time. So what we did is that we used a Bayesian model that we call a joint Bayesian model. That means that it considers the correlation of the measurements and the variability between the two devices using complex statistical modeling within the Bayesian framework. So we measured rates of change of the retinal nerve fiber layer in 12 clock hour sectors. We basically converted the SPECTRALIS OCT RNFL measurements to clock hour sectors to make it similar to Cirrus OCT measurements, and also we used the global or average RNFL thickness measurements. So we measured the rates of change in micron per year, and we also measured how many people will show a statistically significant change over time in either negative direction, that's the expected direction where a thinning retinal nerve fiber layer thickness would be a sign of progression of the disease, or in the positive direction, which most likely is an estimate of a noise within the measurements and the analysis. And we obviously compared the amount of variability and noise over time. So what we found was that overall, in general, talking about global RNFL thickness measurements, the average rates of thickness change were larger with SPECTRALIS OCT, and that was statistically significant by about more than 0.2 microns per year, which over a longer period of time is considered clinically relevant. And also we found that there was more variability with Cirrus thickness measurements over time. So the result of this variability, increased variability, is that the SPECTRALIS measurements not only are showing faster rates of change, but also are showing a larger number of sectors or global measurements becoming statistically significant over time, meaning that we can detect change more efficiently or effectively with SPECTRALIS OCT. Now, a couple of things I need to mention is that the measurements of the SPECTRALIS OCT can be corrected manually by researchers, by whoever's carrying out studies, and that's what we did. So we improved, or let's say we corrected the measurement errors that we could for SPECTRALIS OCT measurements, while the Cirrus OCT does not allow you to do that. Therefore, that's one of the potential reasons that the performance of the SPECTRALIS OCT was better. Also, we're talking here about the measurement circle measurements coming from the measuring circle of the SPECTRALIS and the Kouros OCT. And the way the two devices work is a little different. Kouros provides you with a block or volume scan of data, a cube of data. So that provides you a more extensive amount of data, but the benefit that SPECTRALIS OCT has is that it measures the same measurement, basically circle of a scans up to 100 times. So that leads to, while Kouros cannot do that because it's doing measuring a wider area of the eye and peripapillary retina. So the result is that the measurement noise decreases and diminishes with the SPECTRALIS OCT, and therefore the quality of the measurements are better, the quality of segmentation does look better, and therefore you have less noise. So that kind of explains that part. And so overall, comparing between the two devices, it seems that when we're concentrating and focusing on only the measurement circle, the measurements over time, be it global or sectoral, seem to be performing better when we're using the data from SPECTRALIS OCT. And I did not mention that also the differences we saw between the two devices were also seen sectorally as well. In some of the sectors, mostly inferior and inferior nasal sectors, we also saw the same trend, while the difference is in the superior sectors and superior nasal and temporal sectors were not significant, but the differences were definitely seen between the inferior intranasal and temporal sectors. And that's the area of the retinal nerve fiber layer thickness where commonly changes to glaucoma happen. And so that's another reason that we think the findings are clinically relevant. I like the high quality of the measurements. It's easy to see the segmentations, and also as a researcher, clinician scientist, we frequently have to correct the measurements, and it's really allows you to go back and where needed to correct the measurement and enhance the measurements in case the automatic segmentation algorithm of the device has made mistakes, so we can fix those and therefore make the data more plausible, and that makes a difference when we're doing subsequent analysis with regard to a spatial detection of progression, be it in the macula or at the level of the retinal nerve fiber layer.